Warm welcome to the third Impact webinar of this year. It's a pleasure to have you all here today. My name is Juliane Mielke and I'm a postdoc at the University of Basel and a member of the Impact Core Group. It's great for us to see such a diverse international audience. We have over 500 registrations for this workshop from participants from all over the world. Of course, not everyone attends in person, but we appreciate that many will be watching the recording, which will be available on our Impact website afterwards. The focus of today's webinar is on system science methods for implementation science, and this topic reflects a growing interest in understanding complex and dynamic relationships, especially in regard to context and implementation mechanisms. During previous webinars, the question of how to embrace system science methods has been raised several times, and I think it highlights the interest and the need in this field. We are therefore delighted to welcome our guest, Dr. Bo Kim. She will provide us more insights into the world of system science methods that can be used for implementation science. Dr. Kim is an investigator at the United States Department of Veterans Affairs, VA, Center for Healthcare Organization and Implementation Research, and an assistant professor of psychiatry at Harvard Medical School. She directs the evaluation core of the VA Behavioral Health Quality Enhancement Research Initiative Query program and is the systems lead for the implementation core of the VA Bridging the Care Continuum Query program. Dr. Kim has a background in system science and engineering, and her research interests are in applying interdisciplinary methodologies towards studying the quality and implementation of health and related services, such as for her query grant in partnership with the VA Homeless Programs Office that evaluates the implementation of VA efforts to improve access to legal services for veterans. So we are very excited to have Dr. Kim with us today. We will have sufficient time at the end of her talk for discussion. So please feel free to write your comments, reflections, or questions in the chat, as we want to foster a lively discussion. We have always participants with different levels of expertise, so we encourage everyone to engage actively during the discussion session, and all questions are welcome. Before we start off, I would also like to draw your attention to the Impact Conference in November in Geneva. The conference theme is the value of implementation science in health and social care. And we have an exciting program, including a pre-conference workshop and a special industry workshop. And there will be a full program of with international keynote speakers, presentations, and a roundtable discussion. So we would be delighted to welcome you to the conference in Geneva. With that being said, I would like to turn it over to you, Dr. Kim, and look very much forward to your presentation.
Thank you so much for the introduction. And I will go ahead and share my slides then. Well, thank you all so much for having me today. I'm so excited to be here, be able to talk about work that my colleagues and I are very passionate about, and hope that we'll have a lively discussion after the lecture part of the seminar today. So in getting started, I wanted to thank the co-authors of the work that I will be primarily talking about today. So importantly, without this team of colleagues that you see on the screen here, none of this work would have been possible. So Gracelyn Cruden, Erica Crable, Andrew Kwambeck, Brian Mittman, and Anjali Wagner, thank you so much. And I also would like to thank my colleagues through the networks of VA Quality Enhancement Research Initiative, or QUERY, Implementation Research Institute, where I have trained and maintained a network, and of course, the Society for Implementation Research Collaboration as well. I just wanted to say quickly that I have no conflicts of interest to report in presenting here today, and the views to be expressed are my own. We'll talk a little bit today about understanding how implementation strategies affect outcomes and how it's really complicated by many complexities of multi-level systems. We'll get into a little bit also about role of systems analysis methods. So looking forward to discussing that. And then how we have come up with a structured approach for applying systems analysis to study implementation mechanisms, which I'll get into in further detail as well. And then hopefully by doing so, it can be an encouraging seminar through which we can talk about systems analysis, ways in which mechanisms research can move implementation science forward. So as many of you may be already familiar, implementation science really aims to bridge the gap between research and practice by promoting the use of evidence-based interventions. So implementation strategies then are methods to be able to improve how those interventions are adopted in practice. So the success is very context dependent, influenced by so many different factors, and understanding therefore sort of the mechanisms behind when strategies work or don't work are very important. And we don't really learn, if we don't learn how the strategies work or fail, then we risk really implementing ineffective solutions that can potentially lead to outcomes that are not desirable. So let's actually go to a first poll question here. So the question that would be great to hear your input on is, how familiar are you with the concept of implementation mechanisms? So the options here are, I have never heard of implementation mechanisms. I am beginning to learn about implementation mechanisms, or I teach, or I can teach because I know so much about implementation mechanisms. Oh, I already see that somebody is an expert in implementation mechanisms. So whoever that may be, I think this is an anonymous poll, but I hope that you will help me answer some of the difficult questions that might come up later. It's great to see that some people have not heard of implementation mechanisms before, so I'll try to define that a little bit today. And a majority, I think, really it looks like you're beginning to hear more about it through your work, maybe in implementation science, and that you are using or trying to examine implementation mechanisms in the work that you do. Thank you so much for letting me know your familiarity with implementation mechanisms. And yes, I do see two experts for sure, at least two. So looking forward to the discussion part of this as well. Right, so let's move on then from the poll. So in terms of understanding implementation mechanisms, so implementation mechanisms are processes that enable strategies to be able to influence or impact desired outcomes. So understanding these really, we believe, is key for understanding implementation in practice. There are the mechanisms, items that are considered moderators and mediators, which affect respectively the strength and direction of those relationships between strategies and outcomes, or explain how those relationships operate. So being able to distinguish them also could be very helpful. I think it's also important to realize that not all mediators, for example, act as mechanisms, often not by themselves. So it's sometimes helpful to think about different combinations of these mediators and other aspects of mechanisms that need to be concurrently existing for a strategy to actually influence and lead to outcomes. So before I say any more about mechanisms, I thought it might be helpful to share this table. And I won't read through each of the lines here, but we were thankful to be able to base these definitions on Cara Lewis and colleagues' work, seminal work on implementation mechanisms. And as you can see here, I will just read out loud once again the definition of the mechanism, and the others we can read on the slide here. So mechanism is a process or event through which an implementation strategy operates to affect desired implementation outcomes. And so, we maybe there are some of us who come from different backgrounds and disciplinary backgrounds as well. So we may have different understandings of how exactly to define this, and looking forward to discussion regarding that as well. So I'll just take a few seconds here so that you can read through the other definitions as we may be referring to them as we move forward. So just to kind of think about what mechanisms mean in the context of strategies, et cetera, we can take training as an implementation strategy and use that as an example to think about this together. So the training strategy is aimed at enhancing the use of evidence-based practices among clinicians through skill building. And so this approach really can be critical for effective implementation. Now, a skill building mechanism that is designed to increase engagement with interventions, recognizing how that mechanism operates can then inform how training, the strategy, actually needs to be structured and then delivered. So in doing so, of course, there are various factors that can impede the success of that strategy, including some conditions that may be not met, or there may be low motivation among clinicians and other barriers that affect that causal pathway, as we'll refer to, from strategies to outcomes. So being able to address them through the strategies is really essential for effective implementation. So healthcare systems and other systems that we work in are inherently complex. And so many components that interact, they also change over time. And this complexity makes it challenging to pinpoint effective implementation strategies that straddle or continue throughout time. So being able to understand that dynamism, I think, is very important. And so going back to that training example, the format, for example, of training, whether it's group training or individual training, can significantly affect clinicians' motivation to be able to engage with certain evidence-based practices, and being able to recognize how such social learning influences might be playing a role in training can also help shape that strategy to be group or individual or combined. And so systems analysis methods, which I'll talk about today, are really, I think, vital for understanding some of these complexities. And they're able to provide some of the tools that are needed to drill down and model the interactions within different components within healthcare systems, and helping us identify how specific mechanisms can be activated to be able to improve implementation outcomes, which is what we hope for. So implementation strategies function within these complex systems, as we're talking about, where the activation of certain mechanisms is constantly influenced by changing components and their relationships with one another. So making the complexities explicit, being very specific about what those complexities are as much as possible, is vital for really identifying some of these mechanisms that we're talking about and what conditions actually activate them. And systems analysis methods are, we believe, these valuable tools for managing such complexity, to then observe the interconnected elements and the dynamics between them that can lead to sometimes very unexpected outcomes, such as because of some policy resistance, let's say, and thus informing better implementation practices in the future, knowing what kind of adjustments need to be made to the strategies under what kind of conditions. So with that background, let's go to poll question 2. So we're talking a lot about complexities. We're talking about sort of complicated situations. So have you encountered situations where the timing or sequence of implementation strategies substantially affected the strategy's success? It is so fun to see the responses come in. And I'm so interested in the no, not really answers, actually. I want to work in that implementation space. So we'll have to talk. I know this is anonymous poll, but I hope you will speak up later and let me know. I want to work in those maybe less complex situations from time to time. It's great to see this breakdown. So it really looks like it is very common for there to be situations where indeed sometimes the timing or the strategy could make a difference. And then there also are times at which it really depends, right? It depends on whether the underlying contexts are dynamically changing more than expected or less than expected. So this is, I guess, to be expected to see the spectrum of different answers. Thank you for your participation here. So systems analysis methods, they allow us to simulate the complex behaviors of healthcare systems. So by capturing certain trends or changes that happen, we're able to better understand how implementation strategies lead to outcomes. So I talk about simulations and being able to calibrate them with good data, of course, can be very key to be able to improve the reliability of some of those predictions that come from the scenarios that are simulated. So this process helps us really anticipate how the different variables interact over time. And using simulations could also help explore those contextual factors and their individual effects or combined effects on implementation strategies over time. So given especially the impracticality, should I say, of testing every single scenario possible in real life, I think we can really benefit from leveraging simulation to be able to test out different variables, really which offers a powerful alternative for refining some of our understanding and enhancing the strategy for real world impacts through implementation. So systems analysis methods, as I was mentioning, we believe they are crucial for modeling these complexities in systems. So they can help identify optimal solutions by considering both qualitative as well as quantitative aspects of characterizing a certain system. And these methods tend to focus on understanding the interactions between the components. And again, by demystifying some of the feedback loops or how they're interconnected, we want to be able to grasp how those changes in one part of the system can really affect others over time. So in studying these implementation mechanisms, systems analysis methods also enable us to identify not only and check on sort of expected outcomes, but also unexpected factors that may be influencing those outcomes. So something that we may not have hypothesized. So that kind of flexibility allows us to continuously check whether our understanding, the mental model that we had about how strategies lead to outcomes is indeed consistent with the data or not, in which case it's very important to update that understanding of ours as well. So in coming up with kind of the structured approach that I'll share with you for systems analysis methods application to implementation mechanisms work, we built heavily on a systems engineering approach that some of our colleagues have put forth. So systems engineering focuses on data-driven decision-making in health systems. So by really carefully diagnosing problems and needs and in a very iterative way, evaluating different options, providing practical recommendations, systems engineering really tries to enhance the overall effectiveness of interventions and implementations to be able to implement them. So in terms of identifying the 4 steps that I'll talk to you about to apply systems analysis methods, we both built on kind of the examples that I'll talk about from Kara Lewis and colleagues' work, as well as drawing on an implementation related systems engineering approach led by Wagner and colleagues as well. And we'll also spend some time to discuss the strengths as well as limitations of some of these steps in terms of thinking about this approach and what that means in terms of future research into implementation mechanisms. As I mentioned briefly, I will actually show a slide after this one, which depicts how we have sort of built on the foundational work of Wagner and colleagues to create these steps that are iterative for applying systems analysis methods. So there are key assumptions that need to hold in the beginning, as you can see at the very top here. And then we want to think about these steps being really iterative in terms of going forth, specifying the strategy, but then being able to test that understand new data may change the needs when it comes to strategies and need to iteratively update our understanding of how strategies lead to outcomes. So it's kind of this arrow that you see on the screen that this is meant to be. And it really starts with the assumptions holding and then elaborating on how the systems analysis methods can guide the decisions on an ongoing way. So the poll question that I wanted to throw out here. So what you just saw is kind of a quick capture, and we'll go into more detail here, but it's a quick capture of how we define a strategy and we have an idea of how that's going to lead to outcomes. But then we take very systematic ways of looking at that and using data to decide whether the strategy still holds or you need to maintain some kind of change about it in order to lead to good outcomes. So it is kind of a systematic way or a methodical way, I should say, of approaching how we decide to tweak or adapt strategies going forward. So I'm just curious, do you currently use a structured approach to specifying and iteratively refining strategies in your implementation work? It is also really good to see some individuals who have joined who may not be actively engaged in implementation work right at this time. I hope that this is a fun introduction, that it will be a fun introduction for you to think about this. Or you may have briefly stepped away from implementation work at this point in time, but the discussion today, hopefully it can encourage you to return to this space as well. So as is the case with many questions that we've posed in the implementation research field, I see that the answer to this, the most popular answer to this is indeed sometimes. So of course, how methodical we're able to be and kind of the data that's available to us to help shape ongoing strategy sort of tuning, it all really depends on the context too, of course, right? The available data, the reasonableness, also the partners that you're working with. So it makes sense that it is a sometimes type of an answer, but I would love to actually, when we open up for discussion, sort of hear about what some of these structured approaches that you are taking to shape implementation strategies are, and how do you sort of help ensure that it gets closer to the outcome for in terms of implementation. So let's perhaps move on then for now. So I wanted to talk about an example that we'll be referring to in some of the materials that we discussed today. Um, as I mentioned earlier, we chose to use Lewis and colleagues' case study to promote sort of a deeper understanding of implementation mechanisms. And because that's from a seminal paper, we thought that we would also be able to add to the literature in that way. So the focus is really on a community mental health center that seeks to implement brief depression symptom severity screening using the patient health questionnaire. And so the ultimate goal really is to be able to enhance the fidelity of depression screenings. And it is really critical for, of course, improving patient outcomes. So let me show you how we have identified or visualized this example. As you can see, the implementation strategies that we have focused on here for illustrative purposes include the training for staff on the PHQ or the patient health questionnaire, as well as financial disincentives for missing the training. So these approaches are crucial for achieving the desired outcomes, but they also are impacted by many of the preconditions and other items that you see there. So this figure hopefully provides somewhat of an adapted visualization of the implementation context, which we will explore more. So I talked about the 4 steps. So let's get right into them. So in terms of step one specifies the implementation strategies and articulate the mechanistic pathway of each implementation strategy to be used, including target mechanisms, preconditions, mediators, moderators, and proximal outcomes that are relevant to mechanism activation. So again, the pathway, it doesn't say anywhere here that it has to be the correct pathway. This is the current latest understanding of the pathway that gets specified in this step 1. And step 1 really involves a structured approach with 4 sub-steps that are under that to guide us in doing that specification that I was just mentioning. So the 4 sub-steps include identifying the implementation strategies, first of all, and then determining the expected mechanisms, and then being able to specify which preconditions, mediators, moderators are relevant, and then outlining the proximal outcomes that will signal and that will let you know, in fact, that the mechanisms have been activated or not. So each of these elements plays a vital role in the overall success of the implementation. And considering the multiple levels of the healthcare system, such as differences between clinician level or organizational level, and now we can think community or policy level moderators as well, it really enhances our understanding of how strategies might operate in varying contexts. And even the same strategy may work through different mechanisms when it's thinking about different levels as such. So utilizing such causal pathway diagrams, and let me just go back a slide or a couple of slides. This is expressed through a causal pathway diagram. It can really help visualize some of those complex relationships, providing clarity on how each component interacts with which other component within the implementation plan here. So in step 1, we can leverage various systems analysis methods, actually, widely recognized, for example, in quality improvement and patient safety. So these methods can help identify, for example, why a particular mechanism may or may not be activated within the implementation framework. So some of the key techniques that some of you may be familiar with here include root cause analysis tools. So things like 5 whys, where you ask why 5 times to hope to get to the root cause, which delves really into the reasons behind a problem. And then similarly, fishbone diagrams for visualizing and categorizing those potential causes. There's also failure modes and effects analysis to be able to preemptively identify risks. So these tools can be adapted to fit the context of implementation science, and they have a long history of being successfully used for really improving on how something is done. In our case, that something being implementation. And engaging different implementation actors. So anyone who may be impacted by or impacting the implementation process is also important. And it is crucial to conduct any of these analyses or root cause analyses, as I was mentioning, or any of the systems analysis methods actually by involving those implementation actors. And their insights can really clarify some of the barriers to mechanism activation. Sometimes it's the reasons are not clear, but their insights as well as experiences might be able to help explain why you're seeing barriers in activating a mechanism that otherwise should have been activated, for example, to lead to implementation outcomes. And building consensus together with these actors on what's the right explanation can help with the mental model that you move forward with. So you saw a causal pathway diagram, and I also wanted to share with you causal loop diagrams, or CLDs as often they're referred to as well. And these are essential systems analytic tools that help us understand how various mechanisms relate to the implementation strategies that we select and decide to deploy and the outcomes that we aim to achieve. So let me just show you the next slide while talking a little more about causal loop diagrams. So they provide, as you can see, a visual representation of those interconnections among these components. And unlike causal pathway diagrams, which you just saw, these causal loop diagrams emphasize dynamic changes over time. So they allow us to see how specific factors and behaviors can either escalate or de-escalate through reinforcing feedback loops, which I'll talk a little bit more about. But this aspect of over time is really vital for understanding some of the continuous interactions that occur within complex systems that we work in. And as one of the poll questions adhered to, asked about earlier, sometimes the timing could really matter as to when the strategies are enacted in what ways. So what you're seeing on the screen here, these causal loop diagrams, they can illustrate 2 types of feedback loops. And oftentimes we talk about them in terms of reinforcing loops or balancing loops. So in the picture here, I think you can see sort of the R and the B as those reinforcing and balancing. So reinforcing feedback loops drive changes in one direction, while balancing feedback loops maintain stability within the system. So for instance, even the best strategies, let's say, to reduce clinic wait times will face limits due to clinician availability and patient care duration, all of those things that could sort of balance or sort of limit some of the immediate large effects that could come from the best strategy to reduce clinic wait time. So it kind of demonstrates how balancing feedback loops can prevent sort of endless improvement or endless decline. So it's really important to have those loops in the system in either of those scenarios. So the causal loop diagram offers, I think, critical insights into some of these pathways involved in implementation strategies. It emphasizes kind of a significant role that organizational leadership can play in supporting these strategies. And this particular causal loop diagram suggests that measuring, for example, that organizational leadership continuously over time can serve potentially as a valuable indicator of implementation success. So this proactive sort of monitoring over time can guide future decisions about resource allocation towards different strategies and how the strategies need to be adjusted. And so I talked about those balancing loops, right? So let's look at like B1 and B2. They sort of emerge from the CLD here, or the causal loop diagram here. So B1, if you look at B1, it illustrates that the motivation required for clinicians can influence the effectiveness of the disincentives. And then B2 also is a balancing loop that shows how as fidelity and screening increases, those financial incentives may need to be sort of further adjusted in order to maintain clinician motivation resulting from them. So you can kind of see the balance that's happening over time. And the causal loop diagram here also highlights skill building as a shared mechanism that can enhance multiple strategies. And so this insight opens up opportunities for creating efficient bundles of implementation strategies, which are very common these days, right? Like we depend on multiple implementation strategies meaningfully bundled together. So instead of doing everything and anything one can possibly do, which is also very resource intensive and sometimes not very I guess, an informed way to spend resources. If we are able to see through understanding the systems, which kind of strategies can be bundled together, that can be the effective and optimal way of going about implementation strategy planning. So in terms of causal diagrams in general, whether they're causal pathway diagrams or the causal loop diagrams that you were just looking at, they not only illustrate, again, not just the hypothesized relationships, but also clarify which relationships should not exist. So for instance, the condition related to training assistance, training attendance, and the clinician's desire to learn, if they are shown as unrelated, then it'll provide a clear view of what to expect when you actually carry out the implementation. So if data from previous studies actually reveal a relationship that contradicts from any of these causal diagrams that you're working with, that's actually very important. That's a point in which it really signals that there is some incomplete understanding of the causal pathway. And so it's a crucial moment in time for guiding sort of the revisions that needs to be made to our mental understanding or the mental model of how strategies are leading to outcomes. And to be able to really enhance our understanding, we can use causal inference tools like causal loop diagrams, or I think people may have used directed acyclic graphs before as well. So again, these really systematically represent causal relationships and can help identify if there are confounders or more robust sort of framework for understanding the mental model that we have in mind. I think one important role also is that oftentimes there are reasons why we carry mental models of strategy to outcome in our minds. It could be based on our experiences with certain populations or work experiences that we have had. So these tools I find to be really meaningful for really identifying where some of those sources of biases could be. So although you may have believed based on one person's experience mental model from strategy to outcome is a certain way. By looking at it and being able to compare that to data, it may be a great opportunity to understand that sometimes those mental models come with biases. And when we take that into implementation efforts, then there may be opportunities to revise that to be able to think about whether there are more universal ways of thinking about it than what you had initially started with. So I mentioned a little bit earlier about scenario simulation, sort of as an essential tool for updating sort of the mechanistic pathways and our understandings and allowing implementers to be able to align their strategies with existing data. So by really computationally testing some of these various implementation scenarios, we can observe potential impacts and outcomes before actually deploying them. So I know I talked a little bit about that earlier, but these simulations really enable us to explore multiple scenarios that estimate different outcomes. Even actually, this is important, even when data is incomplete, they help identify implementation strategies that are robust against certain uncertainties or missing data. So I think it really can help optimize performance as long as we are accounting for and very explicit about which data are available to us versus not. And these simulation models can highlight what additional data we really need if we wanted to make more precise outcome estimates and also effective strategy design as well. So I think these models can help facilitate virtual experiments, which again, without deploying the strategy in the real world, allows decision makers to sort of weigh the trade-offs of different implementation strategies before going and deploying them. So there are simple models like Monte Carlo simulations or others that are recommended for kind of the transparency with which they are able to be used. And then there are more complex models as well. And I think as you'll see when we get to some of the examples of different systems analysis methods, there are definitely a varying degree of complexity and the expertise that are needed to use them. So let's move on to step two, and I'm also mindful of the time. So for step two, I think it'll be important to estimate and test the potential impact of mutable strategies, preconditions, mediators, and moderators on their related mechanisms and observable outcomes, given the specific contexts in which the implementation is to happen. And so thinking about that, simulation models once again provide that platform to test how varying combinations of strategies or mechanisms or their components affect outcomes and which components are mutable versus not, I think are also important to consider here. By simulating those different scenarios, you can observe those effects, and then ultimately the simulations guide your decision making in terms of implementation strategies. Importantly, it helps set realistic expectations about implementation, how much difference you'll see. I think real world complexities may not always point to large signals in implementation success. So what are sort of reasonable things to expect from implementation, as well as what are threshold levels? What are levels after which you decide that a strategy is not worth the effort that goes into deploying at that point in time? So thinking about resource efficiency, therefore, that surrounds being able to deploy strategies in a very manageable way, as well as adapting strategies to be able to meet those resource needs, I think are all part of this. In terms of step three goes into tailoring and updating the implementation strategy based on your findings from having data as well as simulation, perhaps. And so updating the implementation strategy or strategies and including the timing, dosage, and sequencing of actions to be taken to incorporate making changes to mutable preconditions, mediators, moderators, to then enable mechanism activation and subsequent implementation outcomes. So in terms of step three, I was talking about simulations just now. They serve as valuable tools here too, in terms of selecting and refining implementation strategies. For example, we can assess the relative impact of implementing kind of the PHQ questionnaire training, for example, versus the financial disincentive for missed screenings. And it helps deciding the best course of action at that point in time, whether to use one or both of the strategies. And sometimes the combination and sequence of strategies become important as well. And this all ties back to resource allocation insights as we were just talking about. So in implementing these strategies, we can frame the selection process really as an optimization problem in a way. So we're focusing on identifying the most effective combinations of strategies that are available. So simulation models helps us do that. And the primary aim really is to identify those scenarios that maximize positive outcomes while minimizing the resources or efforts that are required to achieve them to be able to have efficient strategy deployment. So following this analysis, we can sort of tailor and update our implementation strategies based on these optimal scenarios, and then simulations can provide insight on how different strategies may impact and interact with one another, actually. So step four. Step four is about applying that updated implementation strategy or strategies, then using newly available data from the implementation effort to further refine or revise the previously specified causal relationships between strategies, mechanisms, preconditions, mediators, moderators, and outcomes. So we now move to sort of applying the implementation strategies that we devised in step three, updated, et cetera, and assess their effectiveness of collecting data on the specified implementation outcomes. So it's really crucial to focus then on gathering data about key components in the causal pathway that indicate mechanism activation, such as number of clinicians who have undergone training. And so really important is to then revisit step one. Remember that iterative arrow that I showed in the beginning, where now that the new data is available, we need to revisit that step to test whether our initially hypothesized current causal relationships still hold or not. And that step is essential for being able to really validate and validate the understanding of the implementation mechanisms. How should we verify relationships, for example, like the one between sort of ability to attend training without penalty and the clinician desire to learn remains still accurate based on the new data? So we need to go back and revise as needed. So let's go to poll question 4. So kind of thinking about systems analytical methods and ways in which they can really start with a certain strategy, but use data and consider the systems level things to be able to adjust the strategy as needed. What are your feelings about how useful you think systems analysis methods can be in improving implementation efforts in your current work? Again, I have to ask people, the healthy skeptics, to be able to join in on the discussion very soon. I would love to hear, and I think these are important discussion forums, but very useful and somewhat useful seem to be quite common here. I think being able to kind of hear from you and discuss more from my experiences as well, some of the application opportunities of some of these structured methods we're talking about might help in further discussions too. So thank you for the poll. So there exist diverse methods actually for approaching systems analysis. And so we actually conducted a focused search of the literature to be able to identify significant examples of systems analysis sort of applied to clarify and test mechanisms in implementation science. So we utilized PubMed as well as NIH Reporter, incorporating forward searches as appropriate from seminal articles, et cetera. So I can go into more detail about the search itself, but I did want to show you sort of a table of some of the methods that we came by in the literature that not only is being used for implementation science, but specifically for looking at implementation mechanisms work. So I'll give you a moment to take a look at that. So as you can see here, some of the examples of systems analysis methods really ranged quite significantly from very quantitative techniques to qualitative methods as well. So what was really ubiquitous is oftentimes the visual representations were common. So I talked to you already about causal pathway diagrams, but as you can see here, ripple effects mapping and other ways in which visualization plays a big role in really solidifying that mental model seem to come through here as well. And then of course, there are computational modeling approaches, because oftentimes some of the things that the simulation and other things that I was just talking about uses showed up here too. So another sort of characteristic, I should say, of any of these systems analysis methods is the involvement of those implementation actors, as I was mentioning. Many of them really have a very participatory, I should say, way of going about these methods. So it involves those people who are impacting and impacted by the implementation work. And what was also interesting to see actually is sort of the a range of approaches and also sort of where the focus really were. I talked to you about 4 different steps. It was interesting to see that at least what we have found through our search is that those early steps of really identifying mechanisms and then evaluating how the strategies and contextual factors impact them, those were usually the steps at which these methods that we found were being used. So we actually did not find many that were used yet to sort of go ahead and collect the data, compare, and then do that iterative update of the strategy, all sort of informed by the systems analysis method. So those later steps and that really iteration going back to step 1 of the 4 steps that I shared, we did not see that yet much in the literature. So maybe that's an opportunity for future research coming up there. So here's the 5th and think possibly the last poll. So would you be interested in, what a loaded question, right? If you'll all excuse me for the loaded question and leading question, would you be interested in further exploring systems analysis methods to investigate mechanisms in your future implementation research or practice? And thank you again for kind of the candid responses. I always appreciate them. And it's really helpful that these are anonymous too, I hope. So I see many definitelys. I think that maybe, of course, we're definitely, I think, open for discussion soon, for more discussions here. And then even for the unlikely, I think it was a part of me that I think it was deliberate for me not putting never, right? So by having unlikely as the last option here, hopefully it leaves us room for more discussion too. So thank you for doing that final poll. So I think in thinking about kind of these systems analysis methods, the steps we outline really emphasize that need for rigorous specification and sort of methodical refinement, that going back that I keep talking about. So these help clarify which implementation strategies are designed to target which mechanisms and therefore which outcomes. So I know the complexities make it difficult, but somehow we're hoping that the ways in which systems analysis methods are really meant for those complex situations, and it can be helpful for teasing out some of those pieces to be able to get a better understanding of these dynamics. And systems analysis methods are critical in sort of various disciplines. We already know other disciplines that have been using them very effectively. So in healthcare and in community settings, et cetera, hopefully the multi-system nature can benefit from some of these being used more often and by more of us researchers as well. And to implement sort of effective change, I think strategies need to be designed to target multiple levels at times. So again, sort of those strategies and through what mechanisms do they affect multiple levels is something we can look at. A multi-level type of modeling, again, not only quantitative, but qualitative understanding of those levels as well can come into play. There are definitely synergistic patterns we always look for as well. So systems analysis is enabling us to be able to capture and reflect patterns of interaction between different synergistic or antagonistic at times strategies and complex relationships when it comes to these studies. And again, kind of the understanding of leveraging those actors, important actors, in hypothesizing the causal pathways and discussing together with them when updates to strategy specification or understandings are made continue to be really important. So it's never sort of the mental model moving forward just as a research team, but again, involving all those people who are impacting or impacted by the process to be able to do so. And the integration of this continues to be key in terms of integrating those inputs. And it's not only with the mental model either, right? So understanding sort of empirical knowledge, being able to interpret it, any good sort of engaged research practices are that way. So practical measurement approaches, of course, like ways in which what is practical versus not, when you know what kind of data is needed more, being able to get input from those actors of implementation are really helpful as well. Ways to document mechanisms are also improving over time. So we don't want to just stay within just our systems analysis methods space. We want to take advantage of other ways in which implementation research and methods are growing and be able to be synergistic with them. So keep up with the latest on how best to document mechanisms, keep up with the latest in visualizations and other shared conventions with fields like quality improvement and patient safety, as I was mentioning earlier. So there are some benefits of these methods, as I hope I was able to somewhat convince you, but we'll talk more. It helps us study mechanisms in relation to multi-level strategies. It also, of course, is important to understand limitations of the approach. The approach key limitation is that it assumes kind of a decision has already been made to implement, and that some outcome already is known as like the desired outcome, and at least one strategy has to be predetermined. So there are other works to be done and ways in which systems analysis can be helpful outside of that iterative circle that I just showed you to better prepare for and more earlier on in the pipeline of implementing as well. There definitely needs to be future research done on this. This is kind of, we're excited that we've sort of put together this first rough piece in a way to try to outline the steps for applying these types of thinking and systems analysis methods to mechanisms research. But really further studies are essential to be able to prospectively apply and test these articulated steps. So looking forward to hopefully being able to collaborate with many of you in pushing forward in that area as well. So in kind of getting close to the close of the presentation here, implementations increasingly focus on sort of, I guess, underserved populations too. So understanding mechanisms allows for more efficient and effective ways of delivering implementation. And that is why understanding the how and why is especially important right now and very timely. So hopefully the role of systems analysis methods can be something that we can look to be able to better do so. And ultimately improving our knowledge of how mechanisms can lead to more effective strategies that can help ensure equitable health outcomes to diverse populations, especially those that undergo systematic marginalization. So that brings me to the end of my prepared slides. I wanted to leave you with this QR code. Some of you may have seen the paper already, which the presentation today was based on. That QR code leads you to that paper about this structured approach to systems analysis methods. And you can see my email address here as well. Even after today and after today's discussion time, I look forward to opportunities to discuss with you further about where this kind of thinking can go.
So thank you so much, Dr. Kim, for your very insightful and inspiring presentation. It's really great to see how system science methods can contribute to moving implementation science as a field forward. And I think it's so important to understand implementation mechanisms and why specific implementation strategies are successful or not for targeting our implementation efforts and also to help to increase implementation success. So thank you very much for this terrific talk. We already have some questions in the chat, and I would like to start with some clarifications. Maria Taneska wrote or asked about the mediator. Would you like to unmute and ask your question?
Yes, thank you. So I just when I looked at the initial causal pathway with examples and the table with explanations of terms, it said that an implementation mechanism is always a mediator between implementation and outcomes, but there can be other mediators that affect this relationship that are not mechanisms. So I was just curious to hear some examples of this, if that makes sense.
Yes, definitely. And there may be different interpretations of this. So, by no means is my kind of example or what I'm about to say sort of how it's accepted in the field or anything like that. I actually take that to mean, and as I mentioned, we took the definitions, thankfully, from Kara Lewis and colleagues' seminal work on mechanisms. I actually take it to mean that implementation mechanisms, once we know what they are, those are indeed mediators. That being said, any mediator by itself might not fully explain the pathway between implementation strategy and how the outcome is reached. So there may need to be either sequentially happening mediators that lead to the outcome or different mediators that happen simultaneously or in parallel that lead to the outcome. So any one of them, implementation mechanisms means that by activating that, the outcome is able to be reached. So I think in my understanding of how we look at this is that not any mediator necessarily by itself is able to fully explain and be a mechanism that as a unit, when turned on, invariably able to lead to outcomes. So I don't know if that helps in explaining some of my understanding of how it's one way arrow and not the other. But does that help or happy to discuss further?
Yes, yes, it helps. So in a way, uh, I mean, this might be simplifying it, but of all the mediators that could bring about an outcome, we choose a few to look at mechanisms for various reasons.
Yes, so some of them may be ones that actually lead to the implementation outcome, and some of them may not be.
Yeah, makes sense. Thank you.
Yeah, thank you for the question.
Thank you. We have another question on data collection by Mitra. Would you like to also unmute? You can briefly introduce yourself and ask your question.
I think you meant Denise, right? About the way you collect the data to perform the CLD. How would you assess the items? Which factor impacts the other and the other way around? Would you assess this in discussions with the project team or the research team? Or would you collect this in surveys, or are there other ways? I'm really curious.
Yes, thank you for that question. Actually, all of the above is my understanding and how we have used it in teams. So we really tried, we understand that any one single form of data may not help explain, again, the complexities that are often involved in these. So we want to, when possible, we want to be able to collect, whether, as you mentioned, survey-based or other ways in which tracking this data is helpful. That being said, in order to really understand why that is happening or being able to really draw those arrows of what makes sense to connect, which components in that diagram should we connect with what, a lot of that actually does have to do with sort of discussions that are had with the involved actors and coming to consensus on based really very heavily often on their experience of working within the system and understanding which components are collected or connected. So in terms of data collection, it really is multiple forms of data when possible, even when understanding that some of those might be missing and not available at every, let's say, time point, but being explicit about where that knowledge of the data originates and being able to take account of that when kind of understanding how strongly do we believe in some of these connections between the components that we see in the model.
Oh, great. Thank you.
We have a next question, which is more related to the causal loop diagram. It is by Martin. Martin, would you like to speak up?
Yes, of course, and thank you so much for this insightful presentation. So my question relates to where you sort of set the boundaries for your causal loop diagram, especially if it's multi-level implementation strategies or multiple implementation strategies. So how do they connect, and then where do you sort of stop adding mediators?
Such a good question. Thank you for that question. And as you can imagine, it really, as many of my answers are, it sort of depends. But I think that actually takes me back to even outside of implementation, when we sort of think about systems, right, and how we analyze systems, this concept of sort of observability and controllability come to mind. So you may be able to sort of include into your representation many different aspects or components of a system. But if you're not able to, let's say, track it or observe what is happening to that, then to what extent does it actually play a big role in being able to kind of serve a purpose? So it's kind of a, it's a decision to be made to whether to include it or not. But including it, if you're not able to sort of track it or track proxies for it, I think that may be a reason why sometimes it is helpful to sort of draw a boundary inside of that to not necessarily account for that, or account for that kind of as a box that you may not be able to measure, but know that something is there that needs to be importantly accounted for. So again, it kind of depends on like the observability, controllability. And then in terms of controllability, let me actually say a little bit more, especially for when you're drawing kind of the side of things that you may want to use as a lever for changing the system. And you mentioned multiple levels, right? There may be sort of these different spheres of influence that any one implementer might have. So I may have influence around my immediate team, but maybe I don't have an influence as an implementer for the entire organization. Then what is it that's under my sphere of influence, I think may drive a lot of what I decide to include in the system or not. Being aware that there are these concentric spheres in a way never ending exist is really important. So sometimes when you don't see your model behaving in the way that matches real world data, a reason could be that an important component from a different level may be missing. But thinking about really graspable, at least as a start, graspable components, things that are able to be either observed and or also controllable as an implementer, I think those might be places to start.
Thank you so much for your question, Martin. We have another question also related to the different levels. Flaka, would you like to share your question? You can also start your video if you want.
Yes, I will. Hi, thank you so much for this presentation. It was really insightful. I'm quite a novice in the system analysis method, so that was really insightful. But I was reflecting more on like a lot of our interventions are very complex and they require a lot of strategies. They have synergies between each other. They're not, of course, just like singular things that happen. So how do you, if I would want to do that in our project or with our team, how would I go about depicting the synergies, like the strategies together? Would it be better to kind of do them individually and see where they have anchoring points, or would it be more like presenting them all? Though I kind of think in a diagram form that is probably going to be endless. I mean, in complex interventions, yeah, if you have like even 5, 6 strategies, that's already quite a lot. So I was wondering if you have an insight about that. Thanks.
No, I think you already hit on the challenges of this, which we're experiencing all the time when we're thinking about this. I think it's kind of a little bit of philosophy too. You know how there are different people who think in sort of, there are incremental thinkers like that build from kind of the modular versions up, or there are people who kind of think at the larger level and be able to sort of break down how the connections might be and try to find where the subsystems within that larger thinking might be. So I think it's a little bit of both. I think it's helpful when you're starting, as you said, just so that you're able to describe the things and we've talked about how really all of this is to be as explicit as possible. So in order to be able to do that, I think, and maybe this brings out my philosophy of sometimes being an incrementalist, but kind of being able to lay out the building blocks first so that people are understanding, and then looking at the connections, to me, I think often makes sense. Sometimes to know until when you're going to be building the blocks, I think having the other direction of seeing the big picture and coming to an agreement of what that will be first can help sort of set the important boundaries for that. So I think, again, a little bit of both, but I think, as you mentioned, if you're just getting started with the conversations and thinking together about, okay, let's lay it out there as we begin to decide which ones to actually include in our system of thinking moving forward, I would probably advise going the modular building block way. I'm happy, by the way, anyone on the call, and I know there are some mechanisms experts here, as we saw through the poll. So please chime in and say that that's definitely not the way you go about it. Just letting you know, you all know that you're welcome to chime in.
Maybe also following Flacker's question, I mean, there are often also different centers, clinics we include in our study. So how you do you deal with this? Do you have then different causal loop diagrams for each setting, or yeah, how you tackle this problem?
That's a really good question. So um, the quick answer is sometimes. And it is because there may be times when just sometimes the magnitude of a relationship between system components or the strength with which it is activated at a certain location versus a different site could be the case, in which case you can sort of use these diagrams and dial up and down on some of those parameters that you decide to specify. There may always be inherently different elements that are at play because of the contextual cultures, et cetera. So I think usually when you, for our team, like when we use this and want to go and speak with sort of the actors of an implementation effort that may involve multiple sites of implementation, we try to have that conversation with them up front, such as here is a very rough version of, let's say, a minimum parts or minimum components version of what the different elements of this complex sort of working system might look like. Now, given your specific site's needs or ways in which you experience the culture or the norms of a site, what are aspects that might be specifically either should be removed, should be added, should be more emphasized? So sometimes I think in that conversation that those conversations that are going to bring about sort of those idiosyncrasies or specific natures of individual sites, having a starting place I think is helpful. So some kind of a minimum set idea is something that I'm trying to experiment with these days to see whether that helps in understanding some of the site-to-site tailoring that needs to happen to these models.
Mm-hmm. Okay, thank you. Susan, you raised your hand.
Thank you so much for this presentation. My name is Suzanne. I'm a postdoc at the Institute of Nursing Science. I have actually two questions. In the causal pathway, for the mechanisms, sometimes we feel they are based on assumptions. Is there any like theoretical underpinning that could, empower or have a stronger ground for these mechanisms? And then what if after the implementation and after collecting all this data, you realize that you might need to go back and collect more data to understand the mechanism? So how do you present this and how do you approach it scientifically?
Thank you for asking those questions. Both are really critical points. First one regarding theory or sort of the theoretical underpinnings, it's a big yes. So I did not emphasize that part of it much in the presentation today, but in terms of coming up with potential reasons why some strategy might lead to an outcome, I think understanding sort of behavioral theories, understanding organizational theories, all those multiple sort of interdisciplinary great fields that we come from, and often in implementation science, we have to work with people with expertise from different fields, being able to really draw on theories that have those things that can serve as those strong underpinnings for what we call, at least at the start, right? At least as a start, what we consider to be mechanisms, I think is very, very key. So thank you for actually asking that question. I did not emphasize that part, but as you start off, the more sort of theoretical underpinnings it can have, I think the more, I think strength there is. And there's also an opportunity to sort of think about any modifications to those types of theories that may be needed for certain situations when you find data to be discrepant with what you would have expected based on kind of the theory-based way of thinking about mechanisms. So that's kind of my response to the first question. So a big yes to kind of the theoretical underpinnings part. I think, let's see, in terms of the second part, yes, I think what we're dealing with here, and I know during my presentation, I mentioned multiple times about this like iteration, right? Of like going back and iterating. In a way, it really puts a challenge onto kind of what we often think about as kind of the scientific method, should I say, of like specifying exactly, the hypothesis to be tested, and then like in a quite linear fashion, planning out exactly what you're going to do, and then finishing kind of the investigation of that and being able to kind of confirm that the hypothesis still holds or that you're able to disprove it. So I think it really is a matter of how can you break it still down into pretty discrete investigations that you're doing, but knowing that there is the ultimate goal of being able to then reuse the data to adjust some of the assumptions that you have gone in with. So I think in our hope of putting forth kind of this iterative steps, I think was to be able to help serve, if possible, as somewhat of a framework that people are able to refer to and say, here's step one. We started out with this kind of an understanding. By moving on to step two and actually using the data, we actually found that there may be some discrepancies in how we had initially envisioned it. Let's kind of in a framework aligned way, move on to the step three of being able to refine, and then therefore go back then as a step four and evolving back to step one, go back to readjusting the strategy. So part of our kind of ambitious hope and putting forth this still rough, so there may be hopefully there will be iterations of this way, is to kind of provide some way of creating a way to talk about the exact issue that you're talking about. How do we do science around something that can be so dynamic in a way and changing? So hopefully, like if we're able to maintain some kind of consistency or methodic ways in which different studies are following the same type of pathway, at least we're able to then put them side by side and come up with more, I guess, widely applicable knowledge regarding how these steps work, they don't work, what kind of things need to be thought about, etc.
Thank you so much. Juliana, may I have one last question?
Yeah, please go ahead, Susan.
So this iterative process is very interesting, really, and it engages many parties, many members, scientific or stakeholders sometimes. Do we need to report all these steps or only the refinement?
I feel like I'm answering every single question with it depends, but it kind of depends. I think it is actually so what I would like to stress is this kind of an approach, especially the parts that involve, as you said, many parties, many different parties, really should draw on sort of best practices of sort of group facilitation and group discussions, right? So this is not something that's just for this approach. You're connecting with your partners or different people. In general, for many of the implementation work or efforts that are carried out, even if we did nothing about these systems analysis methods, you will be making that connection and having that conversation. Now, when you think about what you decide to discuss and what you don't decide to discuss, there are guiding principles that your team or our teams have in approaching that. You want to be transparent as much as possible. At the same time, you want to deliver information in a way that is understandable, that the decisions that you need them to help you make can be clear in their heads. So that's why I say it depends in terms of some of the level of details. If it's not helpful for them seeing the big enough picture to decide which may be some of these important components, etc., then deliberately you can decide to not necessarily have that be front and center. Of course, being open to them that if you want to see the details, we can discuss that, but here is the conceptual level of things. So just like any discussion with any partner might be, even if it's not systems analysis methods related, it kind of comes down to kind of a judgment call of how do you deliver the information in the most effective way so that they can have the information needed to help make the decisions that you need them to help make.
Thank you very much.
Thank you.
We have another question concerning the preconditions, and my apologies if I pronounce the name wrong. It's from Jenna Neski. Would you like to ask her question and to unmute?
Yes, can you hear me?
Yeah, we can hear you well. Yeah, you can also start your video if you like.
Oh, it's okay. Yeah, so I was wondering if the cultural influence play a role in the implementation strategy. Because I think you come from the East, now you can see the both sides, I imagine.
Yes, I very much appreciate you asking that. Yes, I think this is another one of those big yes answers that I would like to give. Um, I was just at at a conference. I was at the Society for Implementation Research Collaboration conference last week, and one really exciting presentation of many exciting presentations that I saw was about sort of this reflexivity of where as the implementer or the implementing team comes into the picture and how our contexts might be influencing the implementation. And I think this idea of sort of the influencing of kind of where the implementation is happening. Of course, we think a lot about sort of the people who are there endogenously, the system that we're working in, but actually as we come into it and as we have to form a team or a partnership with them, I think understanding where those cultural influences are is so key. So something that may be an important precondition, maybe less so, depending on which culture you're actually acting in. So I think it is very much the case that this becomes one of those preconditions where if you are working within very diverse contexts, then you will, I think, need or really find it to be very helpful to think about the culture and the influence really being a key component of needing to probably adjust in the model depending on where you're working at. I'm not sure whether that was sort of the essence of your question, or if not, I'm happy to discuss further.
No, it's okay. You answered my question.
Great, thank you.
Okay, we have another question related to learning opportunities. So Lauren Clark asked a question. Yeah.
Hi, Bo. It's good, nice to see you
Hi,
after
so nice to
meeting
see you.
in Denver last week. Hi.
Yes.
Yes, thanks so much for this presentation. And I have a question that I think is shared by a couple of the people on the call because I see some thumbs up coming in, and that is I am really a big fan of this field, very interested, but at the same time feeling a little bit of hesitancy because I wouldn't consider myself an expert in systems thinking. And I think a lot of people can relate to that, having an interest in this group of methods, but not a lot of training. And so, do you have recommendations on where to start?
Yes, we actually deal with this quite a bit. I feel like every time we have opportunities to present this work, for example, we get asked questions such as, how do you balance like the heavy lifting that is needed to actually learn and do these types of methods versus the actual return on that investment that you're going to get from doing so. So this is something very, constantly that we are struggling with. I would like to emphasize, though, I think we think about, and today, of course, I talked a lot about sort of simulations, which I often can immediately feel like they are, all computational methods, et cetera. But they really, I think there are really, there are methods that really span the whole spectrum of of being applicable to systems thinking. So some of the very sort of technique specific ones, or ones that you need specific tools for, that you need somebody who is able to run those tools to be able to run. Yes, I think partnership, of course, is best for those opportunities. Just as you and I were at, like being at the conference, trying to connect with people who may have like their team members or team members who are interested in collaborating with you on those pieces might be one way to go. But for the other kind of the thinking part, the systems thinking part of items, I do really believe that those are things that, again, may not necessarily have to take a decade to be able to master. It really is about I think after all, it comes down to very basic concepts at times of really sometimes even going back to areas of, I know I've mentioned already during today's call, like quality improvement and just respect for persons, and thinking about like how you are able to connect with different people with different perspectives. Try to, as much as possible, make explicit, and oftentimes it involves visualizations, sort of the connections that you're seeing between different pieces. We can put like fancy names to them, like we can say like, oh, that's called ripple effects mapping, or this, but actually you are really in a way just putting down explicitly maybe visually or in a different way? If so, just making explicit what the different things that are interplaying with different things are. So I wouldn't hesitate to, start putting out the I'm a systems expert card, even if it's not necessarily that you have a, like a computational technique or otherwise that you're using for systems science. I hope it's kind of along the lines of what you were asking.
Very much so, thank you. And I think it was also a big realization for me that a lot of these techniques are also qualitative. So you don't necessarily, like you said, have to have a degree in computational engineering for some of these things to be quite accessible. So thank you for those thoughts.
Of course, and I wanted to add that I'm so glad you just mentioned that, because I wanted to emphasize even further that it's not even that you do qualitative methods when quantitative methods are not available or anything like that. There are inherently cases, and especially in the types of complex sort of systems cases that we're looking into, that some things that are measurable are maybe quite limited, right? So to really understand some of those connections, I think mixed methods really should be embraced. And I think there's value in everything in that spectrum, from highly qualitative to highly quantitative ways of thinking about systems.
Good. And I also saw there are some suggestions in the chat by Adrian and Thomas Engel. So thank you so much for your inputs about learning resources for system science. So if there are no further questions, I would like to close the session and to wrap up. So Dr. Kim, we truly appreciate you being with us today. And it was really an inspiring session. And for those who would like to revisit the session, the webinar will be soon available on the Impact website. I also want to announce the last webinar for this year. We also have a slide. So the last webinar will be in December, and we will have a roundtable with editors of implementation science journals. So we will have Gregory Ahrens, Paul Wilson, Bianca Albers, and Sales. So this will be really an interesting exchange. And lastly, I would highlight again the upcoming third Swiss Impact Conference in Geneva. So there are a few places still available, and there will be a mix of international and Swiss projects presented, interactive roundtable discussion and workshops. And I would like to especially highlight the industry workshop that focuses on the role of implementation science in the pharmaceutical industry. So the program is available online, so please have a look. If you would like to stay tuned to what's happening in the Swiss Impact Network, you can register on our Impact website or follow us on social media. So thank you once again, Dr. Kim. It was really a pleasure having you today, and thank you also for all who participated. I wish you a wonderful rest of your day and all the best.
Thank you so much.